Hi everyone, my name is Sadie Brown and welcome to the Vuka Show, where we have conversations on HIV prevention methods and choices. So today I have an amazing guest. Her name is Anna and she's based in Harare. Hi Anna, welcome to the show.
Hi, Sadie. Thank you
How
so
are
much, and I'm happy to
you?
be here. I'm great. I'm great. It's a bit cold but sunny, but I love it.
Yeah, it's cold but sunny. It's the same here too. So please introduce yourself and let the people know who you are and the awesome work that you do.
Thank you so much. So as Sadie said, I'm Anna, and I work for GNP Plus, which is the global network of people living with HIV. And I am based in Harare in Zimbabwe, and I mainly work within the portfolio of pediatric HIV advocacy and universal health coverage. But I've always been very much interested and a champion in terms of sexual and reproductive health and rights, as well as issues to do with access for adolescent girls and young women, and also very much into HIV prevention commodities and tools and information for adolescent girls and young women.
Yeah, and I'm sure it must be so fun and also quite um interesting as things are standing right now, having to work with adolescent girls and young women, and I'm sure you get to have their experiences on everything pretty much. And I'm just eager to know how the announcement was for your country when last year in July the Piverin ring was approved. How has it been?
Wow, I personally, for me, it was amazing. I was super excited about
Mhm.
that. I mean, just the thought and the ability of being able to have access to a commodity, a tool that could help women in so many ways, adolescent girls in so many ways. I think for me, it was really something that was really good to hear that Zimbabwe had been one of the first countries to actually approve the ring, given the amount of time, the years of research, and the sacrifices that a lot of women put into invested, into being part of clinical researches and the likes. I think it was amazing just to have this happen.
Yeah, and I'm sure it also felt like it was so worth it because these trials were done in Africa, so to have it be approved here must have been quite amazing. I remember here too, in March when they approved it, the mood was just amazing. Everyone was
Mm,
just so happy because it is like the breakthrough we have all been waiting for. And because the trials were here, of course we were just waiting to hear the news of it being
yes,
approved. So man,
yes.
women were just so happy for this.
True, Sadie. And when it comes to sub-Saharan Africa, it always has really, struck a red in terms of HIV infections,
Mhm.
and especially them happening among women and girls. So really having such an announcement, in these two countries that are in sub-Saharan Africa was really revolutionary and really something that meant a lot in terms of HIV prevention. That really made sure that young women can now have access and can now have control over their bodies and their choices.
Yeah. And do you think women still want the ring? Is it still that evolutionary option that women still want?
Definitely, definitely.
Yeah.
I mean, the ring really, like, it's amazing. For
Mm.
me, it really has shown that it can really deliver. An ARV for HIV prevention, and then it's something that's so discreet. It's something that women can control. So for me, I really feel like women do want to have access to the ring. They do want to have the ring, and it's something that's really important for them because a lot of young women and adolescent girls didn't pretty much have choices when it comes to prevention. So for me, this is really one of the many tools for the future when it comes to HIV prevention. And I feel like it's really gonna be more really effective, and also it's something that that even women can really share knowledge and information about to their peers as well. And really having this ring in the hands of women, it's women. Sorry, it's really something that's revolutionary.
Yeah, I hear everything you are saying, and I heard you speak about choice, and I can imagine how restricting that is. Like not having a choice is so restricting, and I think when we speak about HIV prevention, it's important that people are given the choice because we are all dealing with so much, and HIV we won't act like it's not something that like it's shunned upon. So it's
Yeah.
important that people just have choices that appeal to them and their lifestyles. And I really think the ring was going to be that. I also heard you speak about it being discreet, and I think it is such, as you say, it's so revolutionary. It's completely going to change the game.
Yes, so true, Sadie. And I think when we talk about the ring, I feel like it's something that's like a prevention tool. And then this prevention tool is really something that you can be. It needs to be, when we talk of prevention tools, we're talking of something that you can be able to use as an individual, that you can correctly and consistently be able to use. And for me, when it comes to the ring, I feel that this is one thing that young women and girls can use. And the nicest part about the ring is you can actually insert it at home, following the guidance and the advice over how to keep it, store it safely, and also how to insert it and keep it. So this also kind of pushes away the burden of having to continuously be going to a healthcare provider, and also given the busy lives that young women and girls have, working, school, and etc. So it's something that you can really utilize and use in the comfort of your own home.
Thank you so much. We have comments coming in, and the first comment that I'm seeing is a comment from Gloria saying women in sub-Saharan Africa need and want the ring. So we do. We want it. We need it. It's straightforward. We want it and we need it because we have to live. We really have to live our best lives. We are young people. HIV shouldn't be such a heavy burden that we have to constantly be carrying as young people, really.
Exactly,
Yeah,
exactly. And I
it
think
shouldn't be
really,
made there. Mm-hmm.
and I think it really comes at a great time where we all acknowledge that really, modeling studies are really showing that a combination approach is really needed when it comes to ending the epidemic. So the ring comes in to actually work. In correlation to other different methods that young women and girls can use when it comes to other different types of contraception. So which is something that's also very important to have when we're talking of prevention tools that young women and girls can access.
We have another comment saying, I love the conversation. In addition, in January 2021, the WHO recommended that countries offer the ring as an additional HIV prevention choice for women as part of the combination HIV prevention. That's true. And they made these laws. They are the ones who said this is important. So I think it's only fair. It's only fair that they make it available for everyone. They made these laws.
Mhm.
Uh, yeah. So addressing our policymakers and funders watching the show, I would just like to know what are your final words.
So I really feel like when it comes to policymakers, when it comes to donors, when it comes to key stakeholders, they all have a responsibility, Sadie, to facilitate choice and really fund the ring, to ensure that it's in the hands of young women, to ensure there is access, affordability, availability, accessibility, as well as uptake and urgency from young women and adolescent girls to really access this. And I really can't just say what we want them to do without also just recognizing and applauding the move that our different governments made. This is the Ministry of Health in Zimbabwe, the government of Zimbabwe, the research councils, as well as the government of South Africa, as well as the research councils, and everyone who's partaken in this, to getting us to the journey of approving the ring. I feel like that was a great milestone in terms of HIV prevention, and that was a key step in terms of ensuring that we are really ensuring that young women and adolescent girls really have the opportunity to have choice. But after we have done that, let's ensure that we're really, facilitating choice. That is the most important thing. We are facilitating choice, and it's important. It's very, very important. I cannot emphasize enough how important it is to fund the ring.
Thank you so much. Thank you so much for all that you have been saying. Thank you so much for your work. Women really need the ring. It is important that the government funds the ring and the choice is facilitated. That is the mandate. That is all we are asking for. We need the ring. We want it. We deserve to have it. We deserve to have choice. We deserve to choose
Right?
how we want to prevent these HIV infections. So thank you so much. Thank you so much for your work. We have another comment saying ensuring access, availability, affordability, uptake, and urgency. Facilitate choice, hashtag fund the ring. Thank you so much, Anna, for your contributions. You have been amazing. Thank you so much for your work and your role in activism. Thank you so much.
Thank you so much, Sadie. My body, my rights, my choice. Thank you so much.
Yes, yes. We want the ring. Thank you so much. Thank you everyone for joining. Till next time. Bye.
Bye.
Bye.